Well, good afternoon, everyone. Welcome to our learning session sponsored by the Mental Health Action Partnership. I am going to share up some slides to just do a little orientation to the Mental Health Action Partnership, our learning sessions, and just welcome you all for joining us here today for a focus on school mental health, especially important here during the Mental Health Week for children and recognizing that just a great May focus for us here at the Mental Health Action Partnership. I am going to share screen. There we go. First, we'd like to just share a little bit. First, my name is Kathy Markland. I'm with the Wisconsin Association of Family and Children's Agencies. Again, for those of you that just rolled into the room, we invite you to update your Zoom name on your Zoom profile. We'll get to the agenda for this afternoon a little bit later, but part of what we're doing here today, we'll be going into breakout sessions to have some quality networking time. It's a huge part of what we're about at the Mental Health Action Partnership is really creating that opportunity for us to connect in community across providers and lived experience partners and counties and all of our payer partners, everyone who has a touch on mental health services here in the state of Wisconsin. And really happy today to be able to feature our school partners as part of that and really coming to a deeper understanding of where our schools sit in that equation. So a little bit about the Mental Health Action Partnership. Really, we've been formed coming up probably on 3 years now. I might look for a net hot. Yeah, Julia's nodding her head. But really, the Mental Health Action Partnership was designed as a broad, sustainable coalition. We're really aspiring towards equitable access and continuous improvement in integrated mental health care throughout the state of Wisconsin. So you can see here our vision and then some of our objectives that we have for the coalition together. We'll talk a little bit about the organizational piece of the coalition. The coalition is really the kind of the scaffolding for the coalition and support is provided by NAMI Wisconsin. So super gratitude to NAMI Wisconsin for supporting the work of the Mental Health Action Partnership. And then lots of volunteers from various organizations across the state, lots of stakeholder groups that are invested, as you'll see on this slide. I noted peers, families, advocates, counties, folks in our hospital systems, advocacy organizations, our provider and professional associations that I saw some of you on here today. So shout out and thank you for joining us. Nonprofit health systems, our federally qualified health centers and partners there, and then all of our adjacent system stakeholders in education, criminal justice system, public health, primary care. We really are trying to create the broadest catchment we can for all of us that are invested in mental health and mental well-being here across the state of Wisconsin. So thank you all for taking time again to be with us here today. I'd like to cover a little bit about our planned agenda. Working two sets of slides here. So our plan today is to provide for a broad overview. We're obviously not going to be able to get into the full complexity of what it is when we think about school mental health, but we've invited three folks to share some insight with us. And then we will break into some small group discussion. What we really like to do in these learning sessions and really greatly appreciate as are the folks that have been really connected and coordinating around the Mental Health Action Partnership is that this gives us an opportunity when we can go into the small group and come back into large group that we're learning from you all who are doing great work at the grassroots. So we know that many of you have this direct experience that's happening within your own communities, and we want that synergy and that information being brought back into our larger community as we do this joint learning together. Our learning sessions are really just one component of what it is that we are about as the partnership, as noted on the prior slide. We have work groups, and we have a core group that really helps to keep our structure moving forward. So again, I just am grateful to our presenters that are here with us today to move through some of this learning. We're actually going to adjust the agenda just a little bit and kick off with Linda Hall. and start out with Youth Voice, which is a little bit inverted from where we were going to be, and then Jess Frain will join us from DPI. I leaned in hard to my relationships here. WAFCA has been working with the School Mental Health Coalition for a long time, and we have folks who have been deeply involved in that work around supporting comprehensive school mental health. And so I just called in all of the folks that I have had the pleasure to work with, and Jess Frain who's a school mental health consultant with GPI will be joining us. Linda Hall, director of the Office of Children's Mental Health. Um, and then we'll also welcome the chair of the coalition, Amanda Krakowski, who's the director of performance and quality improvement at LSS and who has been chairing the mental health coalition and really to provide for some scoping around financing policy and really thinking about where our opportunities and challenges are around school mental health going forward. So with that, I'm going to kick it over to Linda to get us started. And she's going to start with some scoping around youth voice.
Thanks, Kathy, and thanks to all of you for the opportunity to talk with you a little bit about stuff that is absolutely critical to what we think about when we think about children's mental health. And maybe best to start with me because I'm going to be a little bit more general than I think Jess and Amanda will be. So I want to start by just, oh wait, I'm not running the slides. You're running the slides.
I'm running the slides. You're going to have to
Okay.
tell me when.
I want to start with our vision. The Office of Children's Mental Health is a really small office. There are four of us. We work at a real high-level policy area.
Am I
And
sharing slides?
yep, you're
Okay,
good.
sorry about that.
Yep. And so I just want to take a minute to share our vision for this work, which I think kind of nests within the larger work that you all are looking at. Our vision for kids is that they are safe, nurtured, and supported to achieve their optimal mental health and well-being. Systems are family friendly, they're easy to navigate, they're equitable and inclusive of all people. And you'll see as I go forward that now we're honing in on this and focusing more on belonging. But on the next slide, let me just spend a minute laying the groundwork a little bit about what we see in terms of the current status of youth mental health. This data is from the 2023 Youth Risk Behavior Survey. We're still waiting for the 2025 data. We expect that it'll look pretty much the same with some changes. But here you see that 52% of kids are identifying as anxious, 35% are saying they're sad or hopeless every day. Only 26% of kids are getting sufficient sleep. That's a number we think actually has dropped. 24% of girls, so one in every four girls, is seriously considering suicide. Just stop and think about the girls you know in your life and the fact that one in four could be considering suicide today. And then there's 21% are reporting self-harm. And then on the right side, you see the kind of the priority populations we're looking at. We're always looking at what's happening with these kids because we know that they are experiencing more mental health concerns than the general population. So as Kathy said, this is Children's Mental Health Week, and our theme for the week has been Wired for Belonging. So we know that belonging is tremendously important for kids, not only in combating loneliness, but in actually brain development. So it's where we keep turning back to all the time now. So on the next slide, we'll see that some more reason about why we're focused on belonging. Having a sense of belonging is critical to both the physical and mental health of kids. It's foundational to child well-being. It's the antidote to loneliness, and with the power to fix our crisis of connection. And it's key to unlocking mental wellness. Recently, the American Psychiatric Association shared new guidelines and cited research from the Child Mind Institute that showed that 4 out of 5 parent-child pairs, so parent and child together, 4 out of 5 listed loneliness and social isolation in their top 3 mental health concerns. So every time we look at new research, we keep being pulled back to this belonging issue. So, to achieve belonging, we're focusing on three main strategies: youth belonging, youth leadership, or youth voice. Those kind of overlap, and school mental health. Now, we're focusing on school mental health, which is relevant to your conversation today, because research shows that the children who are able to, less than half of kids are able to obtain mental health treatment. And of the kids who are, over 75% of them got that support or treatment at school. So what's happening in school mental health is important to our kids' youth mental health. And belonging again. School belonging is, school is the place where kids spend most of their day. But unfortunately, I think you could go ahead to the next slide, Kathy. Belonging has been dropping. In over a 10-year period, the rate of belonging dropped 20%. And when we look at it in terms of kids of color, we see that those kids of color experienced even less belonging. Less than half of Hispanic kids, Black, and multiracial children feel that they belong in their school. And we also know that low-income kids tend to be bullied more and are less likely to belong. So belonging is actually a protective factor. We know from research that when youth feel they belong in their school or community, they have better mental health and physical health. They experience less emotional distress and suicidality. They are less likely to engage in substance misuse. They develop trusting relationships who are essential to learning. They have improved academic outcomes. They show up at school. They graduate. They have increased rates of higher education enrollment. And for kids who felt they belonged in high school, later in adulthood, they had higher incomes than those who did not feel this way. So it has all kinds of impacts for kids. So turning now a little bit to youth voice and youth leadership, we find that this is an important vehicle for students and young people, especially at school. One place that this is happening in school is at student-led mental wellness groups. So like NAMI Raise Your Voice, Sources of Strength. Many are rooted in suicide prevention. Some address wellness and more generally, and some really focus on stigma reduction. So these school-based programs are student-led, usually with an advisor who supports student leaders in designing activities that aim to increase mental health awareness throughout the school, support for student mental health, and student skills to support themselves and their peers who may be having a mental health challenge. So as this slide shows, we have on our website, we've plotted out the 340 schools that have a program like this, so that we know that the majority of the 421 school districts in the state have a program like this. And these programs are helping kids forge connections with one another, build positive school cultures, and build also more supportive school communities. A recent study found that one of these programs reduced suicide attempts by 29%. So we've been convening these youth, and we know that they, along with their adult advisors, are really helping to improve not only the mental health and wellness in their school communities, but also in their broader community. They make a difference. And these kids talk about how they are addressing mental wellness in their community. So, partnering with schools on this work or encouraging youth to join their school's wellness program can really be a productive step forward. I mentioned that we were convening these students. We've done it for 3 years in a row now, had over 300 high schoolers who are peer leaders in these programs come to Madison. And we asked them if their own sense of well-being improved since they joined the group. And 94%, 9 out of 10 said yes. So for us, this is proof that these programs make a difference. We're also feeling like with having convened so many students now over so many years and surveyed them on different things, that we're starting to build our own database showing this. So pretty excited about that when we have concerns about where the quality of national data is going these days. Okay, moving on. Belonging increases when youth are actively engaged in positive relationships, when they feel welcome, safe, cared for, and supported, when they feel that they matter and their voice is heard. So we know what the pieces are. We know the things are that we can do to make a difference for these kids. I wanted to go on to tell you a little bit about the Youth Mental Wellness Champions program that we launched in the fall of 2025, really to reinforce our commitment to listening to youth voice on how to address youth wellness. We invited students from across Wisconsin to apply to meet with us monthly throughout the school year to expand their mental health literacy, to learn about mental health in general, to learn about the history of mental health treatment, and to learn about the current Wisconsin mental health system, and then also strategies to improve student wellness in their school and their community and across the state. So we were very excited that we got a mix of students with various leadership skills, various mental health experiences, and from a wide geographic area in the state. Our goal was to get one student from each of the 12 CSAs, the Cooperative Education Service Agencies, and we were able to do that. So we wanted to be sure that we were collecting information and building relationships with kids from all over the state, so we could really have a good picture of what they think is happening with wellness and how adults should be responding to it. So at our 2025 annual report briefing at the Capitol, we kind of had a lovely twist there. One of our champions who was speaking at the briefing, when we had asked her to share about when she feels like she belongs, and she said the champion program. We didn't know she was going to say that. It was pretty exciting. And if it's been really exciting to meet with these kids every month. We meet with them 7:30 to 9 at night. They all show up, and they're struggling to stay awake sometimes because they already had long days, but they're engaged and they're excited about what they're learning. And what we're just really seeing again is that when kids are listened to, when their voices are heard, they feel valued and they feel like they belong. And we know that this work can and is already being done in schools across the state. We just need to continue to support it. And I wanted to share one other example of belonging strategies. The Mount Horeb schools are addressing belonging through a three-pronged strategy: messaging students, training staff, and encouraging families. The staff component is especially important because having a trusted and supportive relationship with adults, not just your own parents, is without question one of the hallmarks of positive mental health. So we're really excited to see that they are focusing on that. And it also helps because students tell us that they really want more adults in the school, not just the school social worker or the counselor, but more adults to be equipped and feel comfortable talking with them about mental health. So this is a really good example. We actually wrote up this program in our Successful Solutions series. So we have on our website, we have a whole page that is devoted to successful things, strategies that schools and communities are doing to increase belonging and increase mental health in their community. So before ending, I wanted to leave. Sorry? Okay, before leaving, I just wanted to leave you with a few questions you could ask about whether belonging is being cultivated at the schools in your community. So, do students feel like they belong? Are mental health supports available at school? Do students know and use these supports? We find that they don't always know about them. Do families know about these supports? And do schools engage families well? You know, this engaging families is important for student belonging and for addressing mental health issues, not only because parents are needed to sign off on treatment, but because parents' comfort with or sense of belonging in the broader school community can significantly impact how their kids feel about how they belong at school. So with that, I will be happy to answer questions now or later. I plan to stay around and be part of the conversation. Thanks for having me.
Linda, thanks so much for joining us. I love that we started with Youth Voice because I think that we know that one of the pillars of putting together comprehensive school mental health programs is really about embracing those who are in the community, both all the staff and the students, to help establish, what is safety, what does belonging look like, and so it's a really great cornerstone for our conversation and takes us right over into Jessica Frain from DPI, who is here with us today. And so I am going to shift over to Jess. I'm going to stop sharing so you can share your slides. And we're really looking forward to sort of the overview framework of how school mental health shows up here in Wisconsin. So thanks so much for joining us, Jess.
Yes, thank you, Kathy. And Linda is like a perfect segue, as you probably know. Linda and I work very closely together, as do Kathy and I. So I'm Jess Frain. I just dropped my slides in the chat just because I was having some weird technical issues, so they're not going to be part of the main slide deck. And I am sharing lots of resources as I go here, so I want to make sure you all have access to those as I'm talking. Let me just share my screen. I want to apologize as well. I am dealing with a nasty cold, so I don't sound like myself right now, but we're gonna get through this together. Um, all right, are you all able to see those slides fine? Okay, cool. Thank you. Um, Okay, so yeah, I'm going to spend the next 15 minutes just kind of going over the Wisconsin School Mental Health Framework, some of the components of what Kathy's been talking about, just the comprehensive school mental health system. So how our state agency kind of approaches school mental health and how we support schools on the ground level, like in the field with this. So first off, to kind of paint the picture, because I know I learned like a lot of you are big experts in this field, but maybe schools are not the specialty area. So I'm just going to do like a really high level overview. So me at the state education agency, I'm a school mental health consultant. I work on a small team called the Student Services Team. So it's made up of kind of like what it looks like in a school district. So a school social work consultant, school counseling, school psychology, school nursing, and school health. So we kind of make up the student services departments that are often seen in schools, but we're like the go-to at the state level for that. So we help with, the policy side of things. We help to kind of manage the funding that's coming in through the state budget, but also federal grant opportunities related to school mental health. And as you all kind of know, mental health is can turn into a catch-all phrase when it comes to funding and policy. So we do a lot of different things under that umbrella. So I'll kind of outline what that looks like. But yeah, that's kind of the gist of what I do. I also oversee a $9 million federal grant project that I'll just really lightly introduce you to towards the end of my 15 minutes here. So before I dive into the actual framework, I just wanted to kind of, as we're thinking about school mental health, when we think about that, I think traditionally so my background's in school social work. And even when I was in the schools, which wasn't that long ago, within the last 10 years, school mental health was very much treated as like through like a crisis mindset. So my role was very much focused on what we call like tier 3 interventions, some of the crisis response work, some of our students that just had very significant struggles with their mental health. That was really kind of the only way that we were approaching school mental health. And it's a really important piece of the puzzle. But what I love about how Linda started us off is that our state has really done a ton of work to try to shift out of just that crisis response mode. And I'm sure a lot of you I can even see some of you nodding, like I'm speaking to the choir here. That type of shift to that prevention work is so critical. And when we're talking about schools, it's such an important place, following up on that belonging aspect. We know that if we start putting resources towards like more of those universal supports, we're going to see less of that, top heavy approach to school mental health. So I wanted to just kind of set the groundwork for like how we got to the point of writing a new framework for our state when it comes to school mental health. So we did it in a way that was aligning with best practices and kind of shifting away from that, only thinking about it. Linda said it perfectly. School mental health shouldn't just be about like school social workers and school counselors. It should be about every single adult that's interacting with students. We all carry that work. So that's just a little bit of kind of the mindset shift that we've been doing. So a few years ago, we released an updated version that moves into that different kind of paradigm shift of school mental health, of our framework. So we have a Wisconsin school mental health framework that is our way of structuring all of the support that we push out to schools as it relates to school mental health. So it's based, like I mentioned, on national best practice. So we're very close partners with the National Center for School Mental Health. They're housed at the University of Maryland. They actually helped consult when we developed this framework. And so we've aligned our components, which I'm going to walk through with you, to their quality domain. So it helps because we're keeping up with best practice. We know how to support schools in the way that, other states are doing this as well. And not to brag, but the National Center always says Wisconsin is doing the best work with the framework. So just saying, we're kind of like ahead of the game with some of this, which is really exciting. Um, the idea that it's aligned to the multi-level systems of support, that's some school lingo that basically means like all the other supports that happen in a school, whether it's academics or behavior or what have you. There's kind of like a DNA that exists in every school that structures all of those. And this is meant to integrate right into that so it doesn't feel like this big hefty extra thing that a school's doing. And then I'll touch a little bit on what that trauma sensitive schools piece of it is as well. But this is the frameworks graphic. So what I want to do is, take a little bit of time to just talk a little bit about each one of these 6 components so it helps paint a picture. I'm thinking about all the folks in the room here and Linda said it really well, but when you're thinking about like how you're partnering with schools, every single one of the components of our comprehensive system has an opportunity for our partners. Like that's kind of the point of it, is how to de-silo this work. So when I talk about these, just try to imagine like, okay, that in my community, that would make total sense for my organization to kind of support this within the school district. So these are the 6 components of a comprehensive school mental health system in Wisconsin. Like I said, I'll do my best to walk through these quickly so it kind of brings it to life a little bit. And what I did is I attached resources for each component that I'm going to walk through, but I'm not going to go through them. I basically just wanted you to, if you're interested in that, you now have it and you can poke around. We have probably too many resources on DPI's webpage, so I didn't want to overwhelm the group with those. But just to like ground it in a little bit of research, so we do know now, after enough years of rolling out comprehensive school mental health systems nationwide, that and even outside of our country, the more this is growing, research is showing a lot of really positive outcomes. So very aligned actually to what Linda was sharing with belongingness. And again, this is like looking outside of just those, therapeutic interventions and in crisis interventions, and thinking about like whole school-wide interventions and how to support, from that universal level. So it's really cool to see that the stuff that we're really investing in is having some great outcomes as well. So I mentioned the idea of trauma sensitive schools. That might be a newer concept to some of you, but I would imagine you can probably understand what that is. It's trauma informed care, but in a school. So very similar that for those of you who use this in your practice as well. So in the school world, we have these 6 guiding principles. It's very much aligned to all other types of trauma informed care. So I won't go into these heavily, but what I wanted to do is just share, when we're talking about this with schools, this looks great in theory that, you're applying all these principles to your school system, but we've developed a lot of tools. I highlighted one just to kind of paint a picture for you what we're talking about. We've got a lot of tools to actually bring this into practice. So if a school wants to just ensure that they're a trauma sensitive school, one of our tools I really love is our policy review tool. So it takes those principles we just saw on the previous screen And you can actually take any policy, any practice, any protocol you have in a building and actually rate it. Like, how are we doing as far as being trauma sensitive? Where are like little entry points that our team can focus on improving to actually become more trauma sensitive? So again, it even goes just beyond some of that individual intervention with students and looks more at your system. So that's a lot of what we focus on is instead of this heavy focus on, pathologizing our students and really working at that individual fixing students level, how do we step back and just focus on our systems and really try to change our adult practices and policies to be better supportive of all of our kids? So that's kind of the trauma sensitive piece. The other aspect, before I get into the components of the system that I wanted to highlight, it goes right along with what Linda was just talking about. We're leaning really heavily into this idea of building mental health literacy for students and staff. So actually, Linda's team and my team came together a few years ago and developed mental health literacy curriculum for students that can be applied in the schools. We've really been focused on staff mental health literacy. So kind of goes to right where Linda kind of handed this off to me. Our teachers, our, paraprofessionals, our administrators, all those non-school mental health professionals, putting actual skills in their hands for how to intervene, how to just have supportive conversations around mental health, how to use destigmatizing language. We're seeing a lot of interest in this. So we ran a parallel mental health literacy program to the student one that Linda just talked about for adults. And we had folks from all over the state that learned all about this, wanted to bring it back to their district. So wanted to highlight that's something that our team's definitely investing in. We've got, again, I won't go through all the resources, but if that's of interest, we've got a whole online module learning system. We've got way too many resources related to that. We're really excited about that initiative. So I'm back up now to the framework. So those bubbles you saw earlier from our graphic, I want to, like I said, just kind of bring it to life a little bit here. So the first component of that big school mental health framework is our continuum of supports. So to kind of help paint the picture, like in the school, this is that whole continuum of every type of mental health support we have available, all the way from the mental health literacy stuff we were just talking about, or those youth groups that Linda was talking about, all the way up to having therapists employed by schools or contracted with schools. Some of those, post-crisis intervention and post-vention work. So it's basically, mapping all the good supports across the continuum. So that's kind of the first anchor of all the components, and we like to say kind of the most important one. Again, I won't go through these, but like I said, I'm going to just allow you all to kind of, if you're interested in each of the components, resources, they're there for you. So the next bubble of the 6 is collaboration. So this is like the biggest one that I wanted to highlight for all of you. A lot of times in schools, we get really kind of narrow vision and we're stuck in our little school bubble, and it's hard for us to, partner outside of the school. I think internal partnerships have really increased and grown for schools, but having a way to connect outward to folks like you, to folks at the state like me, regional partners, that's been a huge shift for school mental health. And the way it's helping strengthen systems is just unbelievable. So if there's one takeaway I ask of this group, it's just to kind of think creatively of ways you can help support any part of the continuum. So not even just like the interventions at that top level, but like providing training to staff related to belongingness or related to mental health literacy. There's so many ways to support. So yeah, this is the biggest component I really wanted to emphasize. And I'll go quickly through the other ones here, but wanted to highlight that the Kathy's Coalition for Expanding School-Based Mental Health, she pulled a lot of us together to help create that third resource on this slide here, which is the collaboration guide for schools and community mental health providers. Highly recommend you peek at that. There were some really great brains that came together to put that guidance stack out just to support that provider school partnership. Obviously, you all know that there's a lot that goes into that kind of partnership. So I'll go quickly through the last ones, but the needs assessment and resource mapping, this is just helping schools to actually think about what the needs are. So like looking at data in a strategic, intentional way, and then mapping actual supports and resources, not just in the school, but outside the school. So we support a lot of schools through that process. Again, more resources related to that component. And then related to that, once you've got, a great referral or a great resource map of all these wonderful resources, we help districts kind of with this referral pathway process. Like it's great to have those, but are you connecting the students and families to the appropriate resources? So that's a big component we help schools with as well. And that comes with the idea of like universal screening or targeted screening in schools. But we've got lots of resources on that one as well. Sustainability, we focus a lot on like we'll talk more about like financial stuff, but thinking also just about staff wellness, like staff want to feel like they belong as well. So we've really been leaning into that. So I included some of our great resources around just like retaining staff and keeping them well as part of the process. And then lastly is data. So we provide a ton of support to districts just around what to do with all the great data they collect and how to use that in a way that informs their system improvement efforts. And so again, the National Center for School Mental Health helps us with this free online data platform that helps schools work through continuous improvement. So that's a big part of the technical assistance that I provide directly to districts. Again, this is kind of one of those like for reference for you, so I don't need to go through each one of these, but I just really wanted to paint a picture that there's a lot of support coming in through state and federal funding that supports different aspects of school mental health. And I know Kathy and Amanda are going to touch more on that when I'm done here. So I don't need to go too into it. If anyone has questions about any of these specific ones, by all means, let me know. And there's lots of info on our website as well. But I wanted to point out specifically the school-based mental health services funding one. That's something I oversee that comes directly out of our state budget. And I just wanted to kind of highlight, this is money that every single school district in the state receives specifically for school mental health. And so my team helps kind of craft what that can look like for schools. And we try to really map it to what I just showed you. We try to map it to that framework model to really help schools focus on some of those universal supports and some of those like system components that they can be spending money building in their comprehensive school mental health system. So I linked some other just supportive things that we provide them in case that's of interest too. But a lot of folks use that money to partner with a lot of mental health organizations in their community. And then lastly, like I said, I wanted to touch on our biggest school mental health project at the state, just to kind of help paint a statewide picture for you. We've got, if anyone's familiar with the term CSAs, those are our regional partners who provide a lot of training and technical assistance directly to school districts. And they do that for every type of topic and initiative. So now we have funding through a SAMHSA grant that's helping us really take everything we do at the state and teach our CSAs about it so that they can be doing it with districts. So what that's done is really just scaled a lot of our work statewide. I have a small team and we can really only reach so many districts every year. So this has been a really great way to scale up that framework we just talked about and give more equitable access to technical assistance for school districts across the state. And then we also have direct support to Forest County, supporting Crandon and Wabeno in building their comprehensive school mental health systems. So yeah, that was kind of the large overview that I wanted to give to this group. If I'm also going to hang out, just like Linda said at the end, if there are any questions, and I see there's some in the chat, so I can pop in my answers when I hand this off here. But thank you so much for allowing me to kind of give a brief overview. It's always really hard for me to keep that short, so I hope that wasn't too fast talky.
Thank you, Jess. I knew it was going to be a wealth of information, and I'm so grateful for how you've gotten to the place where that's really packaged up. That was a pretty tight presentation of a lot of information. For any of you that have had any exposure to our school mental health work over the past decade, I would just want to give kudos to DPI for really how that has evolved over the past 10 years and our involvement with school mental health from a WAFCA lens, the resources that are available there, the organization of those resources, and Jessica's invitation to us to think about where your needs are within your community, where those opportunities are. There's just so many pieces that you can kind of decide this is an area where I can dig in. And so I just really honor that. Both Linda and Jess, thank you so much for giving us some really tangible things that we can do and some tools that we can reach into within our community. So thanks for sharing that. We're going to shift a little bit to talk from more of a stepping up policy space. When I think about our mental health action partnership partners, a lot of us are operating and have really good touch on our behavioral health systems and our service delivery. We have familiarity within our 72 county systems, within our kind of hospitals and clinics and provider community for those that are accessing therapy services. But really, this school space and where that Venn diagram intersects, and understanding sort of those school supports and how we as Jess called out, that collaboration between our community and our schools. I think for me, I am still on the daily, completely humbled by what I don't fully appreciate about the complexity of our school systems and how they function, and thinking about the politics of working within a school community and a school board with the oversight components. When you think about the local levy component that comes in, and needing to manage for all of the costs and supports for our students. 421 school districts across the state. So Jess was really, I guess I'm humble about this, but DPI is resourcing a lot of schools that really and school districts that have a lot of independence in how they adopt and pull these things in, and then are trying to balance in this component with many other demands that we place on our schools. So I know you all have that appreciation working within your communities, but again, just to acknowledge the complexity of those pieces. So we're going to shift a little bit, and I'm going to welcome Amanda Kriskowski here with us. Amanda has worked with us for many years on the School Mental Health Coalition, where we do a lot of work trying to bring together partners and stakeholders who are involved in trying to support comprehensive school mental health systems. I'm going to share up slides again, and then I'm going to kick it over to Amanda to talk a little bit about the work of the coalition, which starts to pull us into some of those higher level policy and funding opportunities and challenges and progress that we're making statewide as we see that. And I am going to share my screen. Here we go.
Thank
And
you,
Amanda,
Kathy.
are you unmuted? There you
I
are.
am.
Cool.
I am unmuted.
And I invite you to share a little bit more, Amanda, about your background and how you come into
Yeah.
this space.
So I started with the coalition pre-COVID, because that's how we measure things right now, pre and post. So it's been quite some time. My background, I have a MSW, so Master's in Social Work, and I have worked in several different states and around the area of Milwaukee for, goodness, 25 years-ish now. So my background is in social work, and I currently work for Lutheran Social Services, and I am currently the Director of Performance and Quality Improvement. So a lot of the work that I do is measuring impact, measuring how we're changing the communities that we work within, looking at those bigger global outcomes as well as individual outcomes for the clients that we serve. And as part of my role back in 2016, really started to develop a program at LSS on how we were going to do school mental health. And we are now in 11 schools in the Milwaukee area, both at Milwaukee Public Schools, as well as some other schools in the community that are not a part of the public school system. So speaking from both the coalition and also a provider of the service from an organizational standpoint. And as far as you can see here, our mission, we really are looking to expand school, but comprehensive school mental health, and what we've talked about with the integration and the partnerships between community organizations and community providers and the schools. Oftentimes when we start talking with school social workers and school counselors, we hear, they're already stretched real thin, that they don't have either the ability through time or through education to really hone in and provide therapeutic services to children one-on-one in the school setting. So we partner with schools that want us in there, and I think that's a big part of this is the school has to be ready, which is part of what Jess was talking about too. The school has to be ready for the partnership, and the partner has to be ready to be able to go in and be in that school, have a presence, being able to work with the students one-on-one. So a big piece that we have done with the coalition is advocacy and really looking at how do we fund these partnerships and how do we make it on both ends so that the providers in the community are getting reimbursed at a level that is sustainable, while also being able to work with the school and work with the grants that they are receiving. And we'll get into a bunch of that. So with our agenda and what we look at for our policy and our advocacy that we do, we have 3 areas that we're really focusing on. So we're looking at grants, workforce, and insurance. So the first one with grants, we're really looking at those mechanisms of working with the grant programs through the state, through DPI, and looking at those opportunities where grants are given to the schools for student mental health. And a lot of the grants we had back in, was it 23, 25, I believe, year, we had every school, every district in the state was able to receive money for student mental health, which was fantastic. And it was dependent, there was a floor that everybody got, and then depending on how many students you had in your district, the money increased. So this was fantastic. It was capped at a certain percentage that was allowed to go towards direct service care, but it allowed for tier 1, tier 2, and tier 3 interventions. So having some district-wide curriculums that might be used, working with groups of students at a time, and then also being able to partner with some community partners. And over the years, we have looked to grow that bucket and get districts get that floor raised and also get the per capita of student raised. And we continue to advocate for that. And then with the workforce, just a few things that we look at there. We are really looking at the support and growth and looking at psychologists, social workers, nurses, counselors, all in the school, as well as looking at the qualified treatment trainees, so QTTs, and having the ability to use QTTs within the school system and that mental health system. And then as far as insurance goes, really looking at how can we advance how insurance pays for mental health within schools. And as I'm sure many of you are aware, we have families that may have insurance but are dealing with high deductibles, prior authorizations that are required, restricted networks where maybe their network isn't a part of what the provider that's in the school is actually doing. So we've had some of those conflicts that we've had to work through. We've worked with specific school districts on how to help open that up as well. And then we're also looking at supporting parent peer specialists. So being able to look at those who have the lived experience, being able to work with families to help them with the mental health that they are working with within their home as well. And how can we get that paid for through insurance coverage and Badger Care as well. So as we look at the different funding streams that all goes into school mental health in Wisconsin, we have some of the district funding, and just had that great display of all the different funding streams that are coming in through DPI and through the state. Some of that goes directly through the district. We have some federal funding options. We have some insurance as well. But as, again, I'm sure many of you know, Medicaid and Medicare reimbursement isn't the highest rate for partners like LSS and others that are in this space. So a lot of what we also have to do is find other mechanisms to be able to help subsidize the cost of going in. And a lot of times school districts help with that with the grants that they're getting, but we also have foundations. So just speaking for my organization and the work that we do, we have a large chunk of the services that we are providing is funded through private donors and foundations that are supporting the work and want us to be in the schools. And just a graphic here looking at on the left-hand side, those are all the different funding streams that can funnel in towards the school, that the school then has to decide what to do with them. And there might be caps on how they use some of that funding, whether they're able to use it with a partner or not. On the right-hand side, you're looking at the community partners and the therapists that are contracted to work with the schools, and they're pulling in that money from Medicaid, through private insurance, through those private donors and funders that are supporting the work as well. And then inside that circle in the school with the child that's waving hi, the little child that's being helped by all the services we're providing. Those are all the individuals that are really a part of this coordination process. So we have to think about where are we with the school social workers, who are usually the ones who identify who that child is who needs the services, who then reaches out to the school, to the partnering organization, the community partner, who then provides those services. We also have to get the parents on board to be able to sign that paperwork, to be able to see the child in the school. And then we're also working with the teachers and the staff, because those children are being pulled out of a class or two, during a week to be able to be seen. So there's all these layers of partnerships that have to occur to make this whole system work. And there's all these different funding streams that get braided together to really support the efforts moving forward. It is a complicated system. And I know, Kathy, you were going to talk about our highlights here.
I was going to just pull out a few items as we've looked at the landscape of what's been happening in school mental health, and just a few things to highlight for you all, and we will share these slides. Some of the pieces that the coalition has supported, that we've worked very collaboratively with our school partners around to try to continue to advance the resources that are available through our schools for school-based mental health. Some of it has been enhancement in Medicaid funding over time, like the adoption of the Medicaid consultation code, which now that we're able to do some billing to do that collaboration and coordination within our school settings. And I also just wanted to note the advancement in the school-based services component that DHS has recently initiated, which expanded the kind of school-based services that are going to be reimbursable under Medicaid. There's still work to be done to make that really a viable funding stream for our schools. But we do see opportunity space there moving forward for thinking about how Medicaid could be a more robust component of supporting within our school services systems, for our school social workers, for our school counselors, that there are some billable elements moving forward that may help to get schools to a place where they can make those really viable positions. So noting that, and then where we see other opportunities emerging when we think about the evolution of what's happening, we look at the use of telehealth and teletherapy and know that we have lots of providers that are in that space, that schools are flexing on that. Our rural schools also, our urban schools as well, and that it's making sure that we're adopting that and moving that in a way that's going to be most supportive for our students and our families. What I hear from providers as we work with them, and what I hear from schools, is that one of the things that's very helpful for the teletherapy piece is that it does make connection with families sometimes easier, actually, because we've had, maybe had difficulty getting parents to the school building, but we're able to do some of that connection on the telehealth piece remotely. That has helped to make sure that we're maintaining that family engagement. Just wanted to note those examples of student assistance programs. So there's a lot of schools that have used their funding to support some kind of, it's like EAP, but for schools. So honor those programs that have started to emerge, which have provided for parent coaching, for quick dip supports, for more immediate access supports for some of our students. And also some of the grants have been used for high deductible insurance scholarships. So again, creatively thinking about how we remove some of those barriers for our families. And then I wanted to note the growth of the trust-based philanthropy and local funder support. We've had some really great projects underway in the state that are really totally that are focusing on school mental health as a place to help schools learn how to develop resources locally and really bring in those community partners, including funders as community partners in that and supporting what may be able to happen within the school community. I think challenges we see continued and worsening funding disparities among districts. I think even as we have school mental health grants that are being provided to each of the school districts, there are disparities in terms of levy abilities for each of the school districts. We know that there are really complex fund pieces that come together within our to support our schools, and so those disparities, I think there's some exacerbation of some of those disparities as we look across the state. Lack of sustainable funding for our systems. So there's been uncertainty. We've seen our grants for our school mental health grants in particular, while they had grown to $50 million over this biennium, they are returning to a lower funding amount moving forward. And so knowing that there's an opportunity there to do more to support sustainable funding for our schools. And then Medicaid rates. The majority of our kids in schools that receive services are Medicaid funded. And that's a reality. And in order for those services, again, and when we need that therapeutic level, and so just really honoring that we're talking about three tiers of support, and that this is really an issue that pings mostly in that top tier for those students that are receiving direct therapeutic services. But Medicaid is a key piece of what puts all of that together. We're going to transition into some small group discussion and really invite you to hang with us and to move into these small group spaces. Again, this is where we're able to synthesize some of this. Really simple questions for you all today. I'm going to pop them in the chat here as well. How does this information that you've heard today really resonate with your own direct experience around school mental health services in your community? Are there things that you heard today that kind of surprised you or that you were like, oh, I need to dig into that more? Let's go into small group and share that. And then we'd like to come back out and have some conversation with our panelists. So we are at 3:29. Julia, I'm thinking we're going in for 15 minutes into small groups, if that's okay. And just invite you all to hang with us and stick with it on Friday afternoon, and let's have some conversation and meet some new people. Thank you. Well, welcome back, everyone. It's always one of these moments when you get into these breakout rooms that I wish we could be recording every single breakout room also, because I know I hope you all had some rich conversations and networked and met with some people in your rooms. I want to hold space and time as we're wrapping up here today for questions that might have come that you would like to share with our panelists. Anything that people want to bring forward out of their room, or observations or learnings that happened in your breakout spaces. Feel free to drop them in the chat too. Oh, Rick.
Well, first of all, it's amazing just thinking about how far school-based mental health has come in the past 10 years in Wisconsin. Absolutely incredible. The things that I, as a clinician, was wondering about is a concern that I've heard somewhat over the years is the challenges and limitations in engaging with families. Sometimes a resource issue, sometimes in terms of staff time. So I'm wondering how far that's come, because it seemed to be focusing more on the student primarily some time ago. And the others is I've worked with some clinicians that provide in-school services. Some are quite strong in evidence-based practices. I just commented in the breakout how impressive Jefferson County has been over the years in that regard. And if there's resources, because often that's training issue, resource issue to bring those evidence-based practices to bear. And as we look at outcomes, there's certainly a correlation. So family and support for evidence-based practices.
Any of our panelists want to jump in on any kind of reflection on that?
I would just say, quick on the family part. I'm so glad you brought that up because it's such an important part of the whole picture for student mental health. And at DPI, we have a whole family engagement team who I've recently been really trying to partner more with, connecting those dots between family engagement and school mental health. And they're doing really incredible work. They're currently kind of developing a family engagement assessment tool that they can, I know we can get a little assessment heavy in the world of education, but it's just so important for districts, I think, right now to actually look at their system and find entry points to make improvements in that area. So we do have a dedicated team at our agency, and we also try to incorporate that into our that big system that I walked through as well. Just didn't really kind of like dig in too deeply into that, but yeah, that's such an important piece of it.
I just wanted to note too, and I don't know if Amanda's going to jump in, but uh, uh, there is a really component, I think Amanda spoke to this and the work that her organization has been doing in particular, but really to bring forward some opportunity to connect directly out into the home community, into the family home, and really looking for models to be able to fund and support some parent peers, some family engagement coaches to be able to do that work. So I think showing a lot of acknowledging, right, that this that maintaining those family relationships are so important, and the power of being able to be more impactful when we're having strong family engagement in these programs. And in terms of evidence-based practice, I love that you're raising Jefferson, and I know we've been doing a lot of work at MHAP around DBT, and they've done some really strong work around DBT in schools in Jefferson also, and kind of covering that across their community. So I hope to see more of that being elevated within our schools to be able to support that evidence. And I think in fact, some of our youth voice programs are evidence-based as well. Other pieces, I see a question. Sita had a question about digging in on school screening. How do you engage family members if results of screening, I'm having a hard time reading this question, sorry. If results of screening show a need, how do you manage family hesitation and engage for financial or stigma reasons? Good question. So, Jess, Linda, anybody want to take that on?
Yeah, we developed a screening guide for schools. I think I linked that in our in the presentation as well. But I know that we're also partnered up with the UW School Mental Health team. So there's a school mental health collaborative based in our UW Madison program. Um, and they're our favorite partners for screening. So they do a lot of direct support to school districts around that. I've actually started pulling them in to help our regional partners know how to talk about screening as well. What I'll say about it is that we're a local control state, Wisconsin, and so we don't have any type of like mandates around anything I talked about in my session. So that's all basically just hoping schools like align to best practice. And that's the same with screening. So some states like Illinois, for instance, just recently made that a policy in state statute that every school has to have a screener. We're not one of those states. So when it comes to like how schools do that, it's very much at the individual school level. But I'm mentioning these other partnerships as like we do have best practice guidance out there around this. And so there's, I think, many different ways to kind of approach family involvement in that. But for the most part, there's always like a, passive consent piece of it. So that's parents and caregivers can opt children out of screening. But I think it kind of goes back to like the mental health literacy push as well. So when we talk about wanting to like increase our school community's mental health literacy, we're also thinking about families and community members so that I think that helps folks understand the importance of screening and what screening does. Because I think we're all coming into mental health with different, biases and experiences with that. So that's kind of a hand-in-hand effort. And I always actually encourage districts to lean into those kinds of, education-based resources while they're doing a screening pilot, just to ensure that that need is met, if that makes sense.
No, I love that you coupled those together, Jess. I think the thing that was coming up for me was really thinking about where school mental health navigators, so our schools that have been able to engage a role around navigation specifically to really help us get from that screening place to create levels of comfort and help to bridge those gaps when our families are looking at, do I have, is there a mental health resource at the school or adjacent to the school that I can connect to? So that navigator role having been really an important development that many of our schools and communities have invested in and put into place to support that family connection piece. And then I think, and I think you addressed beautifully the stigma piece, right? Like that's part of. I see our schools as being such great, like the place to plant these seeds around breaking down stigma, moving ahead, and we see that our students are so open and willing to start to break down some of that stigma and how we start to take that out of the school community and bring it out into the broader community so that we're messaging. And so I love that literacy piece and sort of saying that is a both and strategy if you're going to be doing screening and thinking about this. The other thing that came up with for me in screening that we hear a lot is this concern within our school districts of adopting screening and then identifying needs and not knowing how are we actually serving and supporting those needs. And so wanting to make sure that they have pathways in place for people to connect to resources. Linda.
So I wanted to say that we really dug into screening a couple of years ago and convened folks from around the state who were doing a good deal of screening in their schools. And what we really came away with was that screening is not only to find out what's wrong with kids, it helps you figure out where some kids have strengths and who just needs a little bit more support. So really, we felt a lot of energy around that, and screeners telling us that they would get their foot in the door, and once they were able to share some data with the administrators were coming back to them and say, we want to spend more time and more money on this. Unfortunately, the big cut in funding related to mental health has has led to some of those screening efforts being dropped. Because people just, school administrators just feel like they have to put every penny they can into a classroom. So we've seen a little rollback on that, but we heard a lot that, the fear that you're going to uncover a lot of expense and so you don't want to screen was a little outsized.
No, and I think that I love that observation because I do think that's, it is one of those pieces around where the hesitation space might be and where we can learn from each other when schools have had positive experiences with adopting and moving forward, and being able to see some of those pieces as not necessarily exacerbating sort of costs and schools risk around having done some identification. But I love that observation around the strengths piece as well.
We wrote a playbook on it that's still on our website. So it reviews what efforts were going on in the state and gives people steps as to how to get it going in your school.
That's fantastic. More resources to share. We had another great question in here about transition-aged youth. I feel like that's a whole other webinar, but I'm curious if anybody wants to dive in on continuity in this question of how we're providing for supportive services as we think about this transition-aged youth population moving out of where they may have had supportive services in schools and how we're supporting their mental health into young adulthood. Amanda.
Yeah, I know some of what we've been doing in some of our schools as they transition to the next. We've had meetings leading up to that, so meeting with the staff and the administration in that new school to talk about and implement some of the strategies that we have worked with the current school on. So we've had some of those conversations. We have a few schools that have like a 6-week sort of transition period where they try to do that. We've also had some of our therapists during that transition into the new school go to that new school for the first month or so, just to help make sure that that student is stable. So if it is a case where we can't serve for some reason in that school, we'll help with that transition and then kind of get them set up and back down. We also, one of the funding streams that we use for our program is Comprehensive Community Services, CCS. And through that, our therapists are able to continue to see some students through CCS, and then we'll pick it up that way and still continue to see them through that program. So we're able to have a little bit of flexibility because we're in the Milwaukee area with all the students that we see.
Yeah, Amanda, I'm really glad you flagged CCS because I think we didn't talk today about sort of layering in where counties are payer partners in some of the services that are happening within our schools and in collaboration with our schools. And I think we see really interesting models of where our youth that have qualified in for comprehensive community services are able to that this could be an opportunity to help with some transition questions, but it also is something that can be a braided in part that's showing up and supporting within while our kids are in schools. I think so many rich examples out there of how school mental health is showing up in different places around the state. I want to thank everybody and thank our panelists today for coming and joining us. I just wanted to, we will be sharing out the slides with everybody who participated today so that you have those resources. We have lots of links that we want to share with you beyond and great things that Linda shared with us. So our gratitude to Amanda and Linda and Jess for being part of our panel today and for being here for our Mental Health Action Partnership community. Julia's just dropped a link in for a brief evaluation. We just invite you all to give us your feedback. I'm hearing a ping for transition age youth as maybe a possible future topic, so I'm excited about that for our learning session. It's an area of in my heart space for thinking about how we're doing with that, and if you have some great resources for us at the Mental Health Action Partnership, we certainly welcome you to connect with us. Thank you again. It's 4 o'clock. We're going to wrap it up this afternoon. Have a wonderful weekend, and we were just really gratified you were able to be with us here today.